Welcome to Quaderno Academy, empowering excellence through education. Join us as we inspire growth and unleash your potential. Let's dive in.
When we think about long-term care for our loved ones, our biggest hope is that they don't just get great care, but that they keep their quality of life. Their independence, their spirit. In this explainer, we're going to dive into a philosophy of care that's designed to do exactly that.
It's a question that honestly probably keeps a lot of families up at night. We all have this fear that getting older or dealing with an illness means you're just going to lose your function and who you are. But what if there was a structured way to actually push back against that, to actively work on maintaining or even regaining independence?
Okay, so let's get into it. The answer is this really powerful approach called restorative nursing. And it's not about doing things for a resident. It's all about coaching and empowering them to do things for themselves. It's a complete shift in mindset, really.
So, what's the official definition look like? Well, the key words you got to pay attention to here are highest practicable. This isn't about some impossible dream. It's about meeting each person exactly where they are and helping them reach their personal best. And notice it covers the whole shebang: physical, mental, and social health. Okay, so to make this feel really concrete, let's follow a resident. We'll call her Margaret. Her day, like for so many people, kicks off with a common but pretty huge challenge: just getting dressed. This is what's known as a fundamental activity of daily living, or an ADL.
So after her stroke, Margaret's got weakness on one side of her body. Suddenly, something as simple as putting on a shirt, it's like this impossible, frustrating puzzle. And that can make you feel totally helpless. This is exactly where restorative nursing steps in, to turn a challenge into a win. So what's the secret? Well, it's actually a pretty simple, repeatable technique. First, you make sure there's privacy. Then you follow one golden rule: dress the weak side first. By putting her weak arm into the sleeve first, Margaret can then use her stronger arm to do all the heavy lifting and guide the rest of the shirt. It's such a small change in process, but it makes a world of difference in her being able to do it herself.
And here's the cool part. Margaret isn't going it alone. She has a whole team of clever tools to help her out. I'm talking about things like a sock aid, so she can pull on socks without bending over, or a simple button aid that lets her fasten a cuff with just one hand. These aren't just gadgets, They're like little partners in helping her get her independence back, turning what felt impossible into something she can actually do. All right, so she's dressed. What's next? Well, the focus shifts to mobility. And this is so key, because staying mobile is how you prevent a ton of other complications down the line. Let's see how this next part of Margaret's day builds on that. So first up is something called range of motion, or ROM for short. It's pretty straightforward. If Margaret can move her own joints through the exercises, that's called active ROM. If she needs some help, a caregiver will gently move her joints for her, and that's called passive ROM. Both are absolutely vital for keeping her joints healthy and flexible. But why all the fuss about this? Why is it so important? Because it's all about preventing this nasty enemy called contractures. That's when your muscles and tendons get super tight and basically lock a joint into a painful, permanent position. These simple daily ROM exercises are the absolute frontline defense against that. Okay, so her joints are warmed up, she's ready to go. Now it's time to put all that movement into practice. Margaret is ready for one of the most important parts of her restorative program, her daily walk. And this is where you really see how personalized this whole thing is. It's not like they just hand Margaret any old walker. Nope. The team carefully assesses what she needs. Does she need a lot of stability like you get with a standard walker? Or is her balance pretty good and she just needs a rollator with a seat in case she needs a break? Getting the right tool makes the whole thing achievable and, most importantly, safe. After her walk, it's lunchtime. And, meal times are about so much more than just the food on the plate, right? They're social, they're comforting. But for a lot of residents, they can also be a source of some pretty big challenges. And one of the most serious challenges you can run into is something called dysphagia. That's the medical term for a complex and, frankly, dangerous problem: difficulty swallowing. If you don't manage it carefully, it can lead to some really severe consequences. And listen, this is where everybody, and I mean everybody, including family, becomes part of the care team. Just by knowing what to look for, these warning signs, like if someone is coughing a lot or their voice sounds kind of gurgly after they swallow, you can alert the staff to a potential problem before it turns into a crisis.
Now, moving beyond just the physical stuff, we've got the cognitive side of things, which is so important, especially for residents with dementia. And this quote right here, wow, it is an absolute game changer. It asks us to stop seeing difficult behaviors as just a problem and to start seeing them for what they often are, an attempt to communicate a need. And that big idea, that mindset, it translates into these really simple, practical actions. I'm talking about basic things, like always approaching from the front so you don't startle someone, or instead of asking a big, open-ended question like, what do you want, you offer two simple choices. These small shifts can make a huge difference in cutting down confusion and agitation and just creating a more peaceful connection. So, as we've walked through Margaret's day, you can probably see this is a pretty intricate process, right? It requires a whole lot of coordination. This isn't the job of just one person. It really, truly takes a village. For a restorative program to really work, it takes everyone. I'm talking about the whole crew, from the director of nursing who oversees the whole program, to the therapists who design the plans, to the CNAs who are there every day providing that coaching, and even the dietary staff who are managing food textures. Every single person has a critical role to play. Okay, so let's zoom out and pull this all together. As we've seen, restorative care is really a series of small, intentional actions. But when you add them all up, their impact is just profound. It's about so much more than just checking off physical tasks on a list. And this right here is the absolute heart of it all. When Margaret learns how to put on her own shirt, the real victory isn't the shirt. It's the confidence she gets back. The task is just the method. Dignity is the real outcome. And look, if you need one fact to really drive this home, this is it. What's the #1 predictor of aspiration pneumonia, a lung infection that can be fatal in care facilities? It's not someone's age or other illnesses, it's their dependence on being fed by someone else. So by empowering a resident to feed themselves safely, you're not just giving them independence, you are actively protecting their life. This quote it perfectly captures the whole spirit of this thing. The ability to comb your own hair, to put on your own shirt, to walk yourself to the dining room. These are not small things. They're the absolute building blocks of a person's dignity and their sense of who they are. And that, really, is the big question I want to leave you with. Restorative nursing, it challenges the way we even think about long-term care. It suggests that maybe the goal isn't just to make someone comfortable while they decline, but to partner with them, to coach them, and to help them restore the very essence of who they are, one small, dignified step at a time.
Brought to you by Quaderno KO. Learn smarter, not harder.